Security forces in Guinea demolished a slum in the capital Conakry on Thursday in an attempt to fight the spread of Ebola in the West African state. The action is part of the presidential campaign to clean up crowded areas where the virus could easily spread.
When we say a slum, this is all kind of dangerous. So we are so happy for the help today to destroy these houses. This area was very dangerous for the population and the women who dried fish, and also for the security of the presidential barracks.
Conakry is believed to be one of the dirtiest cities in West Africa, but to the people who live there, it is home.
What they are doing to us is not good. We are Guinean. We are not strangers here. Why all this? Because of Ebola. Leave us so that Ebola can kill us, but don't move us from here.
The humanitarian group Doctors Without Borders said Thursday that the spread of Ebola in Guinea, the initial epicenter of the outbreak, has now slowed and the focus has moved to Liberia and other places. The group's president Joanne said the Ebola crisis will last at least 6 months under the best of circumstances. She spoke in Geneva after a 10-day visit to the region.
I really had the feeling that it is like a wartime in terms of fear, general fear all over where you are, nobody not understanding what's going on.
Liu said the World Health Organization must do more to stabilize the region, especially Liberia.
WHO needs to take a leadership and bring some strong element into the field that are operational. And this needs to happen at all levels.
Fear has prompted some countries to suspend flights to West Africa. The World Health Organization says it is not necessary.
Air travel is a low risk for the transmission of Ebola because Ebola is not an airborne disease. Ebola is transmitted by contact of sick person, and the transmission is done by the body fluid.
The Ebola outbreak has killed more than 1,000 people this year and sickened about 2,000 others. The symptoms include fever, muscular pain, vomiting, diarrhea, and bleeding as vital organs begin breaking down. There is no proven cure. Experts say an early response is essential.
It's really important for people to come into the facility immediately upon having symptoms.
Several vaccines are in early stages of development. The World Health Organization has declared it is ethical to use insufficiently tested drugs and vaccines in such exceptionally dire circumstances. Zlatica Hoke, VOA News, Washington.